bought some sleeping tablets just after the strike off, and I told him a little bit of, you only get 5 minutes with a doctor, don't you? And I was trying, bearing in mind, doctors should really make a bit of time for fellow doctors. I always used to, but maybe I was an exception to the rule. I asked for some sleeping tablets. They literally fought me all the way for 5 sleeping tablets. I was insomnia. I told them about the trials and some of this. The next thing they did, you know what they did? And my wife was in this very room. I was having the court out here. They put the phone down to me. They picked up the phone to my wife, broke my confidentiality, and said, "We're concerned about your husband. Are the trolls in the room with him now?" kind of thing. You know, he sounds very paranoid and delusional, like trying to make it out that it was all in my head, like they do the vaccine injuries. They've all got mental health referrals. They've all been told they're psychiatric patients, not genuinely injured people. So it's a very crazy world. I can't, wake up every morning trying to solve the mystery, but I haven't worked it out yet. Who these people are, who pays them, why me, why Dave Carton and Danny Cool, why haven't they gone for, the richer doctors first? But that's it. It's easy pickings. I can't challenge these things. I mean, if any judicial review looked at this, and I've only touched on some of it today, how do they justify in a judicial review that Dr. Carton's not allowed any of his witnesses? And when we ask the reason why, they say, we're the GMC and we say so. You're not allowed to, entrapment, we spoke about the vaccine exemptions. If you honey trap somebody or agent provocateur them, it's called entrapment. And that's not admissible in the court of law. But the GMC wrote to me when I made that point and said, well, we're the GMC, we can use whatever we want. We can even include hearsay in our evidence bundle. Meanwhile, I had a doctor in my bundle. I had a doctor who was an ex-doctor when I was an A&E doc, who said, amongst 200 and odd other aggressive tweets, where I won't go into detail, but they were pretty sordid stuff. And he said, I'm going to come down to Cornwall, hunt you down and slit your effing throat, or words to that effect. Death threat. Yeah. That went to the GMC. About 3 days later, I get a letter back saying it's not reached threshold for investigation. So we tried to make the point that if you're not investigating this doctor, here we are. 3.5 years have passed. The day I started my tribunal, 3.5 years have passed from the crimes I'd committed. And in that time, I'd had there'd been no restrictions on my practice. The beautiful GMC folk decided at that time, at the beginning, when they received the accusations, they hadn't even spoke to me at this point. They write a letter to every surgery that I worked at in Cornwall. And I never worked at any of the practices again. I've seen one of the letters. It says, to let you know, FYI, your locum doctor David Cartland has been accused of and faces a fitness to practice tribunal for bullying, harassment, incitement, and falsification of medical notes and dishonesty. And now, and I've seen the bottom of the letter, they say, have you got any concerns about Dr. Cartland you'd like to share with us? So phishing. I never worked at these practices again, and I've barely worked in 3 years. Barely worked, other than the time of the second half of the tribunal, where I did 6 weeks working at surgery. I was very open about what happened. I went through the charges with the practice. They were about to offer me a job, and guess what? 2 individuals rang the surgery on my last day, males. Does Dr. Cartland work at your surgery? Yes, he does. Just to let you know, X, Y, Z about me, even though I've been open. If you don't sack him, we'll go to the press. If you don't sack him, we'll go to CQC. That very evening, after I was driving 2.5 hours there, 2.5 hours back to this surgery, how did they know I was there? Number one. Number two, I got a 7 o'clock sheepish email from the senior partner saying, we're going to let you go. We don't want the controversy. And that was the last day I worked as a doctor. At the time I was being hugged by the doctors, and the paramedics were coming in saying, you're that Dave Cartland guy, aren't you? Let me give you a hug. Patients were doing selfies with me. I was doing autographs for them as well as, this is how it was at that surgery. And then they let me go. They just let me go because it's easy for them to do that. And that's the culture in the NHS. Under the carpet, sweep it, and anything bad, loads of stuff going on in maternity units. There's loads of stuff going on in oncology suites. We're getting younger people with aggressive, incurable stage 4 disease. The oncologists must know that. And all they need to do is, how many did they have? Just mentally correlate. I was seeing infertile men. On 1 week I saw, in a week and a half, should I say, I saw 4 men with infertility. They had no sperm in their ejaculate. 3 of them were 3 times jabbed, and 1 of them was 4 times jabbed. I didn't see any unjabbed with azospermia. This is an infertility issue. Then you see midwives reporting that placentas are coming out dishevelled and calcified and dusky and hypoxic, having to give CPR to normal vaginal deliveries, people dying in just normal labour, in figures that are just going off the scale. And people are raising concerns, and they get outed. They get managed out. This is what they do, rather than say, we've got a problem here. We've got a problem, we need to deal with it. Like the AstraZeneca, when I mentioned it to the Doctor, we've got a problem here. We've had 2 deaths and we've had 1 cerebral venous thrombosis. We've got to stop. We've got to investigate. And lo and behold, what happens 6, 8 months later? They pull off the AstraZeneca jab. It got banned. Johnson & Johnson got pulled. So it's not as if they haven't been pulled from the market to back my position.